good day to everyone who is joining today. My name is Oliver Rosenbauer. I will be your moderator today at this launch webinar of the Polio Survivors Fund that we're launching today. So welcome everyone. Thank you for being with us. Today is of course World Disability Day, and we thought it was therefore quite appropriate to hold this event on this day to draw attention to polio as a disease and disability. Maybe to start with just a few housekeeping points before we get into the content. So we're on a Zoom webinar, of course, which we are recording and which we will also make available this recording on our website, poliosurvivorsfund.com at a later date. We have a number of panelists who will just explain briefly about this fund and what it's about and how we will be operating. And after that, we will have a Q&A session where we open it up. Attendees to the webinar are of course muted, but you should see at the bottom of your screen a Q&A panel, and into that you can type your questions, and we will then answer those questions for you. And if you feel appropriate, please tell us also who you are and where you're writing in from or dialing in from. And of course, more information is available on our website, poliosurvivorsfund.com. So that was just a few housekeeping points. Let's get into it. Thank you again for joining. I think the first thing to note perhaps is that the Polio Survivors Fund is a private initiative. It is not an institutional global polio eradication initiative. The Global Polio Eradication Initiative, that remit is of course to eradicate the disease, to eradicate polio, to interrupt transmission of the virus, and that is done entirely through prevention, through vaccination. And that is its focus, and that's correct that that's the focus, and it has to remain the focus. So what the Polio Survivors Fund is as a private initiative is something that tries to address a little bit to provide support to those children who are now still newly affected by polio. Most of us who are going to be on the call today are, of course, in some way or another involved in the Global Polio Eradication Initiative. I myself, for example, work in the polio eradication department at WHO in Geneva as a communications officer. And we all know that there is no cure for polio, but there are things that can be done for survivors to improve the quality of life, to alleviate pain, to alleviate symptoms, to improve mobility. And that is what this is a little bit all about. Now, in countries such as Pakistan or Nigeria, where they have very strong polio eradication infrastructures, such support is already provided as part of their eradication efforts. But what we have found is that sometimes in a newly infected area where polio has not been for a while, such support is very often lacking, and the focus is very much on outbreak response, and the infrastructure is not really there, or the capacity is not really there to care for the children who are actually affected. And so that is hopefully where this fund comes in. So while we are a private initiative, we're all involved in some capacity or another in the polio eradication effort. And so we're able to operate within this existing network, which we have on the ground, the existing infrastructure, to try to deliver the aid. So we are in contact with our polio colleagues on the ground, who they themselves have direct contact to the children who are affected and their families. So they will know exactly what type of support might be best needed, might be delivered, and so forth. And that is what we're here to talk about today. And I'd like to now start to hand over to some of our panelists Initially, the first panelist we had scheduled was Anne-Lee Hussey. Unfortunately, Anne-Lee, due to family reasons, health reasons, is not able to be with us today, but she is with us in spirit. And some of you may know Anne-Lee already. She's an extremely experienced public health advocate, also for polio eradication. She is a polio survivor herself, and she has a tremendous amount of experience in helping polio survivors. She set up clinics in northern Nigeria, for example, to help polio survivors. So her experience and guidance is greatly appreciated, and we're very happy and fortunate that she's agreed to provide us her guidance, even if she cannot be with us today. But moving along, then I would in this instance like to hand over to my colleague Melissa Corkum, who many of you will know. She's with UNICEF, has also worked at WHO for many years in polio eradication all over the world, in Nigeria and Pakistan, in Afghanistan, and she's going to talk to us a little bit about how we're going to try to operationalize some of this support at the country level. So Melissa, great that you're with us, and over to you, please. Thank you.
Hi, everyone, and thanks, Oliver. It's really great to be here today as we launch this Polio Survivors Fund and celebrate World Disability Day. As Oliver mentioned, my name is Melissa, and I've really been privileged to work across this polio team, running immunization programs for UNICEF in places like Afghanistan, Pakistan, and Nigeria. Oliver and I started, I think, 17 years ago in the same office. So it's very much a very close network of people, and in many ways family, and Lee and many others. I really am privileged to work with them. And currently I'm supporting Outbreaks as part of the UNICEF headquarters team. I'd like to say that, as Oliver mentioned, although many of us are working with the Global Polio Eradication Initiative, this new fund is not an entity of the GPI. Really, it's established and managed by a group of us working within the polio program who are really passionate about ensuring those affected by polio are not forgotten or left behind. Our networks and experience, many of us have worked in many different countries. It means that the fund can access these networks and infrastructure that we've been established that's been established to eradicate polio, and really to help with our country teams to identify and provide the necessary support for polio survivors. And that's really lacking in many countries, particularly the outbreak countries, which where no longer have a huge focus on polio anymore, but we continue to have outbreaks, and there's a real need for additional support, which we have in some of the endemic countries, but less so in the endemics. And having worked firsthand in the field for so long, I feel and we feel strongly on the need to also support those affected by polio while also doing our day job of fighting polio. And I think we're very passionate in moving this fund forward, and it's really exciting to see that it's moving forward. We've decided to volunteer our time and energy to work with our polio colleagues on the ground, who themselves are in daily direct contact with newly affected children and their families. And then we're able to identify those most in need on a case-by-case basis and really tailor the support to the local context. And in Outbreaks, we're getting this request more and more. So I think it's timely that we get this off the ground. And by tapping into our networks, we can ensure that the right support reaches the right children and their families. And I think we really look forward to all of you on the line today for your support to make this a reality. Thank you so much.
Thank you, Melissa. That's great, and absolutely, as you said, this is all on a voluntary basis. We're really trying to create a community of eradicarers rather than just being eradicators. And we're of course here to try to mobilize resources, to try to raise funds. But as importantly, or even more importantly, we want to make sure that our colleagues on the ground are aware of this Fund, because obviously we will look to them very much to operationalize the support, since they are the ones who have the contact. If this fund, the inspiration of it was very much the CDC Heroes Fund that you might well be aware of. This was a fund that basically provides financial support to frontline health workers who might have been injured or tragically even worse, killed during polio vaccination campaigns. And again, global, to provide have at the ready a global pool of funds available that country colleagues can draw from. So we're really trying to get the word out about this fund, that this is a resource for our country colleagues. And speaking of country colleagues, with that, I would like to hand over to our next panelist, Dr. Zubair Wadoud, who is one of our most senior polio epidemiologists and polio eradicators. He too has worked for many years all over the Middle East during the Syria outbreak, in Pakistan, of course, and now in Geneva. And he is also the polio program's point man for COVID operations, because as we know, the polio infrastructure is also supporting COVID response, and he is coordinating much of that work. So Zubair, maybe you can tell us about how we plan to operationalize on the ground and why it's particularly important during this COVID, post-COVID period as well. Over to you. Thank you.
Thanks, Oliver. Thanks very much. And firstly, I would like to thank everyone who has taken time out, to join this very important and very different sort of webinar. And this really shows the commitment towards the cause we are, initiating our work towards. So as Oliver mentioned, I'm a medical officer epidemiologist by background, and very lucky to have associated with the polio eradication efforts for more than 15 years. Majority of my time in the past has been at the country level, working in Pakistan, Afghanistan, and areas of the Middle East, but also parts of the African region and some other parts of the world. Mostly focused and mostly pointed towards finding the polio cases and registering them and offering vaccination, but not so much so on this very important part of, reaching out the affected kids and the survivors and helping them out, as much as possible. I think I must mention about a bit of experience I had with this kind of work back in 2007, and it spanned over a period of almost 4 to 5 years, when a local initiative actually was kicked off back then, and I'm not sure if it's going on the same way now, but really I was a field officer then back in the northwest of Pakistan, and one thing that I found out, and I think everybody on the webinar would agree, that these affected individuals and kids and survivors, we were then not, trying to replace the terminology of disabled with differently abled. And in my experience and my interaction with them, that really is true, and we should really reinvigorate that spirit on the eve, on the eve of Disability Day today. So the initiative that I was part of then was sort of termed as improving the quality of life of polio survivors or polio affected children, and it focused on not just physical rehabilitation like physiotherapy, providing prosthetics and other equipments and devices, but also corrective surgery, and it also actually made an effort to help with the education of such kids, because that's also something very, very important. And what I really found is those families that are reached out with this kind of initiative and this kind of help offered, they really themselves become ambassadors for polio eradication. I recall family members of such kids who were offered help under this kind of initiative. They themselves became part of the polio eradication efforts on ground, mobilizing communities, offering vaccination, and and so on and so forth. And I think hence this initiative on one hand supports such populations and such children, but on the other hand also helps engaging those communities better, highlighting the importance of vaccination and importance of vaccination towards healthy future of the kids. So really it can be helpful in multiple ways. And I think this also brings me to another point that that polio is a disease that, in the last more than a decade, since its incidence has only, became geographically restricted only to the populations that are seriously underserved or marginalized, and mostly below the poverty line. So really, I'm fortunate that this group of people on the panel, and hats off to everyone, and Oliver, who kicked off this this initiative, and we are now part of it, and we definitely look forward to spread the tentacles further, engage further with the colleagues and friends at the country level, and that's where the rubber hits the ground, I would say. And as Melissa very rightly mentioned, that this support has to be tailored as per the local context in terms of identifying such families and kids, and then offering them the support in the context they need it in. Lastly, I think I would like to mention that with COVID-19 pandemic now that the whole world is facing over the last few months, 8 or 9 months, I think it has further enhanced the need of this kind of support. We have seen the incidence of polio firstly increasing because the vaccination efforts were sort of paused because of the COVID-19 pandemic. The campaigns and the door-to-door vaccination drives had to be sort of put on a pause or stopped for a few months, and that has allowed the polio virus to sneak out of the areas it was existing in back then in March, and now it has a wider geographical presence. More number of kids are being affected and paralyzed, and COVID-19 pandemic has not just affected the immunization and polio programs delivery, but also generally it has significantly impacted the health service delivery of all sorts. And we are specifically targeting we are specifically mentioning the areas in which the health service delivery was already not that efficient, and access to healthcare was really compromised, and that has further been compromised now by the COVID-19 pandemic. So I think it's the right time to initiate and kick off this initiative, and we are just a handful of people, most of us here at the headquarters level, but with very close contact with the country colleagues. And the objective of this webinar is just to get all of you on board and join hands with us. And we'll be getting in touch with all of you bilaterally or maybe on other such forums. But importantly, to have your inputs and advice on the places you come from and how this initiative can further expand. And also, of course, in terms of, raising as much funds as possible and then utilize those funds towards benefiting these polio survivors and polio affected children. We look forward to be working with you, look forward to be in touch with you and get your full support towards this very noble cause. I will stop here, Oliver. Thank you.
Thank you, Zubair. That's great. And you mentioned, of course, COVID had an impact on health delivery, and you also mentioned polio is of course a disease that now really affects only those children primarily which are really in remote areas with very little infrastructure. And that's of course the tragic irony, is that if they get polio, there's also very little infrastructure to provide support. And again, through this contact with our country colleagues on the ground, You know, as an example, I think two years ago, an outbreak occurred suddenly in Papua New Guinea, in a very remote area of the country, in the highlands, not very easily reachable, and a lot of generous support from public sector donors, you know, to rapidly implement an outbreak response. And we had our colleagues calling us saying, look, we have this family, this child could benefit from rehab. The rehab center is several hours away. We need transportation costs. Or one family was socially outcast as a result of the polio infection and needed to be relocated. But donors were you know, trying to reprogram some of the funds to help support, but it was found very, very difficult, if not near impossible, to kind of reprogram funds that were earmarked by parliaments for outbreak response and prevention to now to provide support. And that's what this fund kind of tries to address, to have this ready-made pool of resources available that our country colleagues can rapidly draw from and provide some support on a very tailored basis in a very, very rapid way. And with that, you know, talking about funds and fundraising, and also how we plan to report out our expenditures and income, I would like to hand over to my colleague Ashley Berman, who's also one of our country liaison specialists, a longtime polio eradicator, also in countries like Pakistan, to tell us a bit more about that. Ashley, welcome, and over to you, please.
Thanks, Oliver. Thank you, everyone, for joining. As Oliver mentioned, I'm Ashley. I have worked in Pakistan, and then I have also worked at the regional office in Emro and supported some of our country offices in Afro. And I now am at WHO HQ, and I work as an information systems project manager. So I have a great opportunity to work across the polio spectrum with all of our partners and across all of the regions. So I'm very fortunate to have many of the contacts that I have, and to learn about some of these issues that Oliver has already mentioned. While in Pakistan, as Zubair mentioned, I also had the opportunity to see some of the efforts of local staff and local individuals working to provide support to polio survivors, and I was very encouraged by this. So when a group of HQ colleagues had suggested that they were going to create this fund, and I jumped on the opportunity to join them, I'm very excited. I was very excited, and I jumped on the opportunity to start fundraising. And I think that's really where we hope that we can continue to drive this fund forward, is through multiple fundraising efforts. And I want to say that our hope is that we can, while we work on eradication, we can hopefully continue to support eradication, as we all are eradicators, but that we want to finally make this fund in the future not needed by eradicating this disease. So through my work, I have seen the drive of eradicators, but seeing the number of diverse attendees today at this launch, I am very encouraged, and it really shows the collective passion for supporting polio survivors and any of those that are impacted by this crippling disease. We've had multiple fundraisers that have been very small at this point. Most of them have been bake sales and other things, and just through these small fundraisers, we've been able to collect around $5,000. So I think that's encouraging. But we have to collect more so that we can have a bigger impact. So we will continue to look for additional fundraising ideas, and we will make those that information available to interested parties through our website. So please make sure you check out our website, poliosurvivors.com. And we are always looking for more ideas from any of you or any colleagues that we come across. We would be happy to work with any of you. In addition, as mentioned by my colleagues, Zubair, Melissa, and Oliver, we do want to make sure that we work with the existing infrastructure on the ground. We have a unique opportunity as being a part of the eradication program and working with our colleagues, that we would be able to find the right individuals with the right support that can provide the correct support to the children that are most in need throughout the globe. So overall, our aim is that there will be no admin costs, because all of us are doing this on a voluntary basis, and we're always looking for more help in any, and every dollar donated will go directly towards support rather than any administrative cost. Our aim is to be fully financially transparent with all of our donors. So we will ensure that we publish an annual income and expenditure report, so everyone is aware of how this fund is operating. So we thank you for your time and attention, and we look forward to hearing more from all of you and getting any of your fundraising ideas, and seeing you continue to support this fund as we give what is needed to the survivors of this crippling disease. Thank you for your attention.
Thank you, Ashley. That's great. And yeah, you raised the important point. This is, we're all volunteers. We have virtually no admin costs. In fact, that is our goal, to have no admin costs. Even costs associated with the website were donated to us. So every dollar should go towards. We're sometimes asked, you know, how much do you need per to provide support to a family? And of course, that will greatly vary because each case will be different. You know, in some instances, it might be, you know, that a scholarship fund is needed, or you know, prosthetics such as braces are needed, or a wheelchair. We had initially done some budgeting in conjunction with an outbreak response in Laos a couple of years ago, and came to around $3,000 to $5,000 per family, depending on different needs, but could provide some support. And as Ashley mentioned, we have about $7,000 or close to $8,000 now in our bank account, which gives us something to start providing some support to some families. But of course, we would like to do more, and to do that, we need more funds. We're now in our discussions with colleagues in Angola and Philippines specifically, and to try to operationalize these initial funds. But Ashley, you're absolutely right. Looking over the chat, it's great. We've got attendees from all over the world, from all sorts of backgrounds, mostly polio eradicators, which is great. So there is clearly interest, and that is great to see. And with that, I would actually like to hand over to our last panelist for the day. And just before I hand it over, just a reminder, if you have questions, do type them into the Q&A section at the bottom of your screen. There should be a Q&A section, and we will get to those. But I would like to hand over to Gautam Lewis, who is we've worked with Gautam for many years in the context of polio eradication. He's a public health advocate. He's now, of course, much more a broadcast journalist. He was involved in eradicating polio frontline health working from India, and he is himself a polio survivor. So Gautam, it's terrific to have you here, and over to you, please. Thank you.
Thank you very much, Oliver, and welcome everyone. As Oliver said, I survived polio at a time and a place in India where perhaps not everyone had the chance to be vaccinated. And because of the poverty and geography that myself and lots of other polio survivors encounter, I grew up in Calcutta, and I was fortunate enough to be taken into the care of Mother Teresa's orphanage. And later on, I had the wonderful love of my mother, Patricia, who then adopted me, and we started life in New Zealand, and then eventually settling in the United Kingdom, in London. I have been one of India's poorest, but at the same time, I was fortunate enough to receive the support that this fund hopes to help others. And the support that I received started in New Zealand and ended up continuing in the UK, which enabled me not just to get physical support that is associated with the illness, but also to receive social, cultural, and professional support that helped me to improve my quality of life through education, and furthermore through ongoing support for my family. I was able to find work, and now I do lots of different things such as teaching English. But I was also able, regardless of the physical disability, I learned to be a pilot, and now we help other people with disabilities, including those with polio, to learn to become pilots as well. So I understand how critical support for people and their families with polio can be. And I hope the Polio Survivors Fund can address this support to other future survivors. And also I've been fortunate enough to learn very deeply about this subject of epidemiology through the work with Rotary International, as well as UNICEF, and of course the World Health Organization, very much in the front line of immunization, going house to house in parts of India. And I learnt a lot through people like Dr. David Heyman, as well as Bruce Elwood, Oliver, and lots of other people that are part of the Polio Alliance. So as a polio survivor, I have a voice that can help mobilize other communities, and I hope that this fund can mobilize other community carers by becoming eradicarers. And I know that this fund can help in lots of ways. We can become donors. I would certainly like to promote this fund through my network. Certainly, like all the others, it is wonderful to be able to give my time and any expertise or knowledge that I may have to help administer this fund. But I think for the global community to understand the importance of country and regional colleagues to help operationalize the fund on the ground. So I am very proud to be a patron of this fund, and I hope that the critical care can be supported to others affected by polio. And I hope the global community can join the eradicators. And thank you very much for participating in this webinar. And thank you, Oliver, for inviting me.
Thank you, Gautam. Thank you so much. That's great and very, very insightful. Of course, you know very well what is most relevant, what kind of support can be most effective. And so it's great to have you part of this to guide us and to help us with this. And as you rightly said, there's many ways to get involved in this. And that is, you know, the aim of this, as we've mentioned a few times, different people have mentioned, to create this community of eradicarers. You know, you donate money, donate your time and expertise to help administer and manage it, and get the word out of it. And you know, speaking of donating time and expertise, and before I open it up to Q&As, since we're now finished with all the panelists, maybe I'd like to just take this opportunity to thank a few people who have donated their time and expertise. Jaina Duperex, she is a student here at the University of Geneva. She has volunteered her time for us and has built our website for us, which we greatly appreciate. Chris Oni, who is an old friend of mine actually from college, an IT expert. He is helping us with IT matters and streamlining processes. That's kind of the other nice thing about this fund. It's a great opportunity to connect with old friends and work with them on projects. Sahaj Verma, who came up with our logo and and social media, as well as I'd like to thank DGE legal consultants here in Geneva, who actually set us up legally as an official tax-exempt Swiss association, so that we're an official legal entity. And all of this was done absolutely pro bono and on a volunteer basis by all these individuals and groups. Again, no admin costs, and we greatly appreciate their time and expertise. So with that, and with many, many thanks to all the panelists, I would like to open it up for the Q&A session. So again, as a reminder, just type in your questions and we will start now. So the first question is, how do you intend to collect the funds? So maybe Ashley, in terms as our fundraising expert, maybe I could hand this over to you, perhaps. Over.
Thanks, Oliver, and thank you, Urs, for the question. We have many ways which we hope to collect the funds. We can take private donations. We are looking at having partnerships where we can find any partnerships, but on our website currently we do have the possibility for individuals to using PayPal to directly donate to our bank account, to the fund, or you can use the banking information that is also on our website and was put into the chat. That is how we hope to collect funds. We also have multiple fundraising ideas that we're planning to do. We hope to get the word out first, and that's what we're trying to do here. While we have some funds, we want to make sure that we start working with our partners in country to find the individuals and work with individuals. At the same time, we'll be continuing to do additional fundraising activities. Unfortunately, with COVID, it makes it a bit more tricky and a bit more difficult for us to do those fundraising activities. So as a committee, as a group of us that are doing this work, we hope to continue to find additional fundraising activities, and we look for all of you to give us your ideas as well for how we can fundraise. But please visit our website, and we do have an opportunity for you to donate directly on our website.
Absolutely. Thank you, Ashley. Yes, do visit our website, poliosurvivorsfund.com, and there's information, our bank account details if you want to do an e-banking transfer or via PayPal, via credit card. There's also other features on our website, such as a testimonials page. So if you would like to, and you can browse through them and see some people have already given video or written testimonials why they support this fund. And at the end of that page, you can see kind of some guidance if you would like to add your own personal testimonial to it, why you think this is important on how to do that. So please do visit. We're also going to feature in there technical guidance documents, which we're in the process of developing with our country colleagues. In other words, how we plan to identify which cases are ideally suitable for which support. And that leads really to the next two questions. I'll take these together. Will the website show the cases and specific projects which need support? So which need support? And then the next question is, are there any specific priority areas for the support to polio survivors? And I wonder if I could take those two questions over to Zubair in terms of how to identify what priority areas we are looking at. Over to you, Zubair.
Thanks, Oliver. So I think this initiative actually is being kicked off as a global initiative. The span of our would definitely be all polio affected countries and subnational geographies. And as we know that we have just two remaining endemic countries globally now, Pakistan, Afghanistan, but a number of countries affected by polio outbreaks in the African region, and a number of kids being paralyzed. So I think in terms of the scope or the radar of this initiative, I think it intends to point its effort towards all polio affected countries and geographies. Now, when it comes to actually providing the support, it would definitely depend upon the mechanism that we will connect to in order to reach those kids, understand their needs, and then offer the support. And that means forming coordination channels, also identifying the channels to utilize the funds, and of course, in addition to that, the expertise, the local expertise in terms of rehab expertise, or providing transport facilitation or whatever. It can be a broad spectrum. So yes, I think we'll move forward, taking all the polio affected areas globally, but then of course initiate the actual groundwork as soon as we spread our tentacles and get in touch with all of you guys. Oliver.
Thank you, Zubair. The next two questions, I'll also take them together. Is it possible to have background documentation on the initiative? And hello, do you have a Twitter handle, Facebook page from where you can raise further awareness? That's from Namita. Hi, nice to see you again. Namita is, we've worked with her for many years. She has been instrumental in helping stop outbreaks in Somalia, several outbreaks. But yes, documentation and awareness raising is high on our agenda, and so our friend Sahej Verma, who we're talking to, has kind of volunteered to help with all sorts of trying to communicate it more widely, including using social media. In the first instance, of course, we have our website, poliosurvivorsfund.com, but we will try to raise this a little bit more. Apologies, that was one of my daughters who is coming to visit. But she actually raises a very good point. She is here, born in Switzerland, and God forbid should she ever be affected by a disease such as polio. In Switzerland, we have the healthcare infrastructure that she would be able to get the support that is needed. And we feel it's not fair that simply because she is born here in Switzerland, she is able to get the help, whereas children in Papua New Guinea are not, simply because they are born there. So that is, of course, also what we try to address. There's a question from Priyanka. Melissa, this one is actually for you. Do you want to take this question? Over to you, Melissa.
Sorry, Oliver, I didn't see the question. Just the support.
So Priyanka says, not really to ask a question, but to say bravo for this initiative. Kudos to Melissa and all. I pledge all my support. Priyanka from UNICEF HQ. So I thought I would hand this over to you. So.
Thank you, and it's great to see so many faces, familiar faces, connected. And I think the more we all work together to get the word out there, spread the word about the website and the potential for support, the better. So it's great to have such a group of dedicated polio eradicators, polio carers, and our extensions connected today. Thanks.
The next question. So in addition, I suggest to begin thinking on what other people can be involved in the polio survivors, families who lost a parent as a vaccinator or supervisor. After that, what kind of sustainable support can be done? Help to develop auto promotion, to have business that can ensure a permanent source of funds, etc. I think those are exactly the kind of suggestions that we are looking for at this point, particularly from the regional and country levels, to see how we can maximize the impact. So this is the discussion that we now that we are in touch with you guys, that everybody is in contact, that we want to explore. So I think this is a conversation we want to continue to have. Yamiogo, thank you very much for that suggestion. From Anand Balachandran, also a longtime polio eradicator, 3 questions. How does the fund plan on selecting projects or recipients? Can you link up with Global Citizen to raise some funds? And will Rotary match some funds? Ashley, sorry that I keep picking on you, but maybe as our finance expert, can I punt this back over to you as well?
Sure, thanks. I'm glad that I'm the fundraising expert. I think there's a few of us that like to do all the fundraising, and I do want to give attention to Tiki and Violen, who are part of this group as well, who are not here and not present, but are also Tiki is present actually, but are also part of the fundraising portion of all of this. And so to first say the Rotary match, no, we don't have any specific matches. And the reason is because we want to make sure that the eradication, GPEI stays as eradicators, and they stick to their work. And we are a private working separately from that, while we all use our connections within GPEI. So currently we don't have any matching, but we're always looking for, if there is ever a desire for either Rotary or the foundation or somebody that likes what we're doing and would like to discuss matching, I think it's always a good option for us. So we're open. I think the main message here is that we're open. And I don't think we've reached out to Global Citizens. Oliver can correct me if I'm wrong, but I don't think we have reached out to them yet. We do have a list of other survivor groups, polio survivor groups that are spread. And it goes to Oliver's point, as he mentioned before, about being a slight, there's an advantage when you're in Switzerland or another country like the UK, the US, and Australia. They all have polio survivor organizations as well. So we are looking forward to trying to reach out and work with them as well, so that we can all collectively work together as Polio Survivors Fund. And we see also the work that's already being done in DRC, etc. That's been written in the chat as well. So there's lots of other groups and organizations that are out there that are also doing kind of what we hope to do, but we just hope to fill a gap wherever we can find that gap. And we need the support from anybody that can provide the support for this project. And Oliver, if I may just also add that for the other question, we are also, when there's a reference to families and polio survivors and vaccinators, the testimonials, please check our testimonials. We have some great testimonials, and we also are looking to potentially look at having a podcast that we can do throughout the year to kind of bring the attention to the polio survivors, their families, the vaccinators, everybody that's a part of the survivors' work, keeping them healthy. And I think that's all I can add. Over back to you.
Thanks, Ashley. And yeah, these are great questions and great suggestions. And in fact, that's what we were waiting for also with this webinar, to await the outcomes. You know, we're just starting out, but next week we plan to kind of convene amongst the group who are involved in this to kind of come up with a much clearer project plan. What do we hope to do in fundraising? What do we hope to do in implementation? And basically kind of, yeah, assign project management. Ashley in particular has great ideas, and so now the work really starts on this. So and these suggestions and ideas are great. And if you want to be actively involved in helping implement some of these activities, please do get back to us, because that is what today is about as well. It is about fundraising. It is about looking for volunteers, and it is about informing our country and regional colleagues that this resource is available. From Urs Herzog, who is a longtime friend from here in Switzerland, a polio survivor himself. He worked as a medical doctor for many years in Cameroon as well. A question, and perhaps I could give this over to Gautam, if I may. He asks, do you plan to look for ambassadors in each country around the world? Gautam, what do you think? Is that feasible, a good idea? Over to you.
I think that's a really great idea. Having been an ambassador and still am for the polio eradication initiative, I found that it was a really wonderful way to spread information, but also to energize people locally. And as an ambassador, I think we can use local network and local resources. For example, how Rotary has been able to use their network in villages. And certainly as an ambassador working primarily from India, it's been a really wonderful way to reach people that I would otherwise never have been able to do. And it's a chance to also continue the advocacy work, and people in countries all around the world, particularly now in Africa that has been polio free, there are voices that otherwise would be hard to reach. So I think there is a wonderful role for ambassadors. So yes, I think that would be great.
Thank you. I agree, and thank you also for the question, Los. So I think that's something, you know, for our agenda for next week to talk about and seeing how we can implement that. The next question: what are the criteria that are considered for enrolling survivors who can receive support? So we've done a lot of talking about that and exactly how to implement it. And of course, as we've talked about, the main channel will be through our country colleagues on the ground. They are the ones who are in contact with the children and their families, and they are the ones who would be able to identify, look, this particular child, what they really need is to be able to go to school, even though they are now affected. So we need some scholarship funds, or this kid needs leg braces or a wheelchair, and then to budget that out, what it would cost, and very importantly, to figure out a way to how to get this support then to that particular child. Is there, for example, a handicap international center nearby, or an ICRC center which specializes on producing braces, and that the braces can also be maintained then, because, you know, it's the child will grow, the braces might need to be adjusted, new braces as the child. So we will want to look at all those criteria to make sure that the support can be sustainable. But it's very broad in terms of the support that is considered. We're considering any support as long as it goes to polio survivors or children and their families newly affected. But it will be very much on a case-by-case basis, working very closely with our colleagues on the ground in identifying, okay, here's the child's symptoms, here's the critical need, here's the budget, and here's how we plan to provide that support. And the other thing, of course, is that because our colleagues are there on the ground, they can ensure that the support is actually provided and it actually reaches the child that is needed. So that is kind of very broadly how we plan to operate. Have you thought to raise a yearly ongoing partnership fee? We hadn't thought about it, Ross, but rather than pick on poor Ashley again, I will just go ahead and answer. We hadn't thought about it, but it's a good idea, and we will discuss in our project planning next week. There are lots of great ideas here, which is wonderful. So I feel like this webinar is already a success, just from that angle. Do you have social media accounts? How can we help promote the new fund? Ashley, I am going to pick on you again on that. Sorry.
First, you can help us promote by sharing our website. That's where everything is currently for us. I think a little bit before, we have some people that have really taken time to volunteer and build the website, and then we have some people that will also help assist us to get the word out a bit more with creating social media. So when we have our social media handle and we have our either Twitter, Instagram, Facebook, whatever our collection is, we'll be sure that we make all of those noted on our website, and hopefully we'll get all of your at least contact details or be able to send information out to all of you on a regular basis, so you can continue to see our updates as we develop this Polio Survivors Fund more and get more established. I think we're still at the very beginning of the phase, so it's great you're giving all the suggestions, and we look forward to taking on more suggestions and working to make it better so that you guys can even advertise for us and be the free advertisement that we need. So thank you.
Thank you, Ashley, and sorry that I keep picking on you. There's a couple of questions from our colleague Susanna. Hi, Susanna, nice to have you with us. Can individual countries present their own proposals and request direct support to the Global Fund, and is there a specific template for that? Yes, absolutely. I mean, that's how we would ideally like to work. Is that the country teams, similar to the CDC Heroes Fund, when tragically, if something happens to a vaccinator, our teams on the ground know immediately, okay, there is this global resource available that we can tap into to provide support for the family of those affected. We want this level of awareness also for this one. We want our country teams on the ground, as they come across a case of polio, of course, to think about outbreak response. That is the top priority, but at the same time, to be aware that there is a potential resource available, that if there is specific support that is needed, that can be provided. And I know you, Susanna, are already in touch with our colleagues in Angola and are trying to set up a call with them to try to do exactly that. So it's great, great to have that. A question from Chip McKinley. How will Polio Survivors Fund identify and assess individual survivors for direct support? Will support be determined by a centralized committee or via ambassadors in the field? It's a very good question. So the way we envisage it, and again, going back to the CDC Heroes Fund, is basically that our country teams or colleagues would come to us, and we have a standard template form that we would ask them to fill in, to provide basic information on the child and the family, when the onset of paralysis was, what sort of treatment options would be available, and what capacity to deliver that treatment option, and then what the budget would be to deliver it. And that would basically be sent to us, and we would be in communication with our colleagues on the ground. And we would evaluate that together, and we have a number of advisors on our panel who can make sure that the support that is provided is actually most relevant. For example, Zubair knows the country realities very, very well in Pakistan, for example. We have another colleague, Andre Mak, who's our clinical advisor. He would be able to look at the symptoms of that particular case and assess, yes, this is most relevant, or this is not most relevant. For example, as an example, not every support at this point in time would we perhaps consider. An example would be rehabilitative or corrective surgery. That is something perhaps that at this time we would be reluctant to engage with, because complications can arise from such surgeries that would need follow-up surgeries, and it might be that that we would do more harm than good, perhaps. So we would again evaluate it on a very, very case-by-case basis, based with people who know the field realities, who know the clinical realities. And I think this is the great advantage that we have. That we've talked about a number of times. We are a private initiative, but we're all part of this great network, the Global Polio Eradication Initiative network, which has been built up to eradicate polio, and we're tapping into that network. We're using that network. We're using our people on the ground who know that particular child, know exactly what that particular child might need, and we have the experts at the global level who can tell us yes or no, this support is most relevant. So that's very, very broadly how we plan to operate. I'm very conscious that we are at the top of the hour, at the end of our time. I know that people have hard stops. I'm sorry we didn't get to everybody's questions. But you know, thank you to everyone who participated today. Thank you, of course, to our panelists, in particular Gautam, and thank you for all your questions. And we would just encourage you, obviously it was great to have everybody online from all over the world. Stay engaged, stay involved with us, be in touch with us either through our WHO and UNICEF email details or through our website. And we're convinced that this can be a very great thing, hopefully. So thank you everyone. And with that, wishing everyone a great rest of the day, and over and out. Thank you.
Bye.
Thank you.